Good morning, good afternoon, good evening. This is Mike Osterholm at the Center for Infectious Disease Research and Policy, or CIDRAP, at the University of Minnesota. Welcome to today's Lassa Fever Research and Development Roadmap Overview. CIDRAP, along with the support from the Wellcome Trust and in collaboration with the World Health Organization, are hosting a series of informational webinars on draft research and development R&D roadmaps, which for the following diseases: Ebola Marburg, Nipah, and Lassa fever. Today you are attending, as you know, the Lassa fever overview. This informational webinar is intended to engage a broad audience in the review and further development of the draft roadmaps by offering opportunities for stakeholders who may not be familiar with the process to learn more about the goals for each roadmap and how to provide feedback. The three roadmaps, including this one, are available on the WHO website for public comment through June 8th of this year. I will provide more information on that, how you access it, and how you provide comments later in the presentation. First of all, let me begin by saying we appreciate you being here and do look forward to your comments, as this is a very important part of the process. Today, I will be going over the overview of the WHO R&D blueprint process, the priority diseases that have been chosen to be part of this blueprint effort, Lassa fever specifically and the background about the disease, the roadmap purpose and objectives, the task force members who have played a critical role in providing expert input, the roadmap vision and architecture, the roadmap strategic goals, and the timeline and public comment period. At the end of this session, you will be able to ask questions by hitting the chat box down on the far right-hand side of your screen and typing in your question, and either I or one of our team members will be able to address these questions for you. Now, in terms of the R&D blueprint overall, as you know, this evolved out of the post-Ebola West Africa experience, realizing that we needed to accelerate research and development of key vaccines, therapeutics, and diagnostics for emerging infectious diseases. The purpose here in this document and the overall vision of the roadmap is A, to improve coordination and foster and enable an environment for these product developments, B, accelerating research and development processes, and C, to develop new norms and standards tailored to the epidemic context. I must tell you that this is still a work in process and progress, and however, we are excited by the progress that has been made to date. Now, if one looks at the overall blueprint from the perspective of how it first began to where we're at today, the prioritization of diseases for roadmap consideration and then the ultimate list of the priority diseases was really the combined work of the Scientific Advisory Group of the SAG and the WHO staff. Once that list was developed, then the Global Coordination Mechanism, which is a group of stakeholders from around the world, including both public and private sector and academia, government, have all inputted into the development of products, clinical trial design, and regulatory pathways. This is informing the R&D roadmaps, which remains under the auspices of the WHO, as is the target product profiles. Then in addition, data sample and sharing, which becomes then part of this entire process, is now something that will be added as we further develop these roadmaps. The monitoring and evaluation of the roadmaps is a process yet to be determined, how it will be done, and where it will be done, but it again will be under the auspices of the WHO. Now, in terms of priority diseases, and this is part of the document that laid out the prioritization criteria, just to define these, for the purpose of the R&D blueprint, WHO has developed a special tool for determining which diseases and pathogens to prioritize for research and development in public health emergency context. This tool seeks to identify those diseases that pose a public health risk because of their epidemic potential and for which there is no or insufficient countermeasures. I think it's clear that if we look at what's happened with Lassa fever over the recent months, as well as the current situation with Ebola in northwestern DRC, we understand exactly what we're talking about in terms of that last sentence. Again, this document can be accessed in the link below, and the second review was done in February of 2018. Now, in terms of priority diseases to date, and I say to date because this is an important point, that this is a living document where new diseases may be added with time and consideration. But to date, it's the Crimean Congo hemorrhagic fever, Ebola and Marburg virus diseases, Lassa fever, the Middle East respiratory syndrome coronavirus, or MERS-CoV, and severe acute respiratory syndrome, or SARS, Nipah and hepativiral diseases, Rift Valley fever, Zika, and more recently, Disease X was added. Disease X represents basically the knowledge that a serious international epidemic could be caused by a pathogen currently unknown to cause human disease. And so the R&D blueprint explicitly seeks to enable cross-cutting R&D preparedness that is also relevant for an unknown disease. What would we do? Where would we go? How do we do it should a new agent emerge? Now, in terms of Lassa fever and its background, let me just say that for most of you on the call, I'm sure you have some familiarity, but let's just remind ourselves. Lassa virus was first identified in 1969. Lassa fever as a disease is endemic in West Africa, particularly in Guinea, Liberia, Nigeria, and Sierra Leone. We know that the primary animal reservoir is the multi-month rat, and that this is a species that may actually be increasing in its range, making this more of a concern for human disease transmission. There's a wide spectrum of manifestations, with greater than 80% of cases having no or mild symptoms, and 20% of the cases having severe life-threatening disease. The 2018 outbreak in Nigeria is ongoing but slowing, but this has been a remarkable past year with regard to Lassa in that area. There is a significant zoonotic potential in West Africa that may be increasing with time. In terms of the overall blueprint approach, this is the document I referred to earlier that is actually provides the framework for what we're doing. This is a document also, again, it's a living document. It is undergoing review and changing. We are really the first with the Ebola, Marburg, Lassa fever, Nipah, Hendroviruses, as well as recent work with MERS and Zika, to really use this methodology, and we're working to inform it at the same time. It's a 40-page document, and I would urge you all to take a look at it if you're trying to understand the background of what we're doing. This methodology was developed by WHO to provide a systematic approach for creating roadmaps. The roadmap methodology really accomplishes four things. It lays out the architecture for each roadmap. It defines the target audience for each of the roadmaps. It identifies roles and responsibilities for key partners with regard to all the aspects of the diagnostics, therapeutics, and vaccines. And finally, it identifies and addresses 6 key elements that need to be considered for roadmap development. 1, who the stakeholder participants are and how to get them to participate. Resource constraints, including issues around business model. Critical inputs that are needed to establish a sound baseline for the science, the research, and development. Roadmap design, buy-in and dissemination, how do we get this to actually be a consequential document, and then monitoring and tracking so that we know, in fact, what we are accomplishing and what is not being accomplished, and in that latter category, what we need to do to change it to accomplishment. Now, in terms of the roadmap purpose and objectives, let me go through those. Here's the purpose. By providing a framework to help plan and coordinate technology developments, roadmaps are pivotal in understanding markets for innovative products and identifying ways to leverage R&D investments through coordinating research activities across a multitude of different partners. And as I will share with you in a moment, we have involved a multitude of research partners as well as the business model participants in terms of the roadmap activity. In terms of the objectives, it is to engage partners and stakeholders, to build consensus on goals and priority areas and activities, and to identify critical steps, challenges, and barriers. Finally, is to promote the implementation and coordination of research and development that's necessary for the success of these various products. Now, we have been very fortunate in having a stellar Lassa fever roadmap task force. It includes here 12 members. You see the first slide, names familiar to many of you as leading experts, the second part of the group here. And these individuals actually met in January back at the Wellcome Trust in London, in which we actually have started working on developing the major framework for the roadmap and have been embellishing it since that time. You're now at a point where we need your input, and which then will be taken back to the task force for further deliberation. Now, in terms of the vision for this, let me go through and make sure that we all understand what we're trying to do here. Of First is to develop robust medical countermeasures to detect, control, and prevent Lassa fever that are readily available and accessible for use in high-risk areas for both endemic and outbreak-related disease. These medical countermeasures include 1, rapid, accurate, and point-of-care diagnostics for Lassa fever, 2, safe and effective treatment, pre-exposure and post-exposure prophylaxis for Lassa fever, and finally 3, safe and effective vaccines to prevent disease, disability, and death from Lassa fever, and to stop person-to-person transmission of the disease. In terms of the architecture, there are actually 4 main sections of this, which include cross-cutting topics that go across each of the product areas, and then the specific product areas, diagnostics, therapeutics, and vaccines. Now, in terms of the roadmap, we also, and from an architectural standpoint, are identifying the primary challenges, key needs, and knowledge gaps. With this, we also have strategic goals, which I'll review for you in a moment. And within the priority areas and activities is obviously research, product development, key capacities necessary for success, and then the policy and commercialization of these products to make them readily available. Now, in terms of the overall strategic goal definition from the roadmap methodology, strategic goals are the planned objectives that a roadmap task force aims to achieve over the period of the strategic plan, whether it be the next year, 5 years, 10 years, whatever is chosen. Strategic goals determine the long-range direction of the research priority areas identified through a road mapping process. They should reflect a realistic assessment of the environment, strengths, weaknesses, opportunities, and threats, and should be based on the stated vision. And that is exactly what we're attempting to do here, and looking forward to your help and support in that process. Now, in terms of looking at the strategic goals, let me first go through those which are cross-cutting topics. Here we actually have identified 4 such cross-cutting topics. 1 is to develop a sustainable value proposition and identify funding sources to promote R&D, availability, and accessibility of Lassa fever medical countermeasures. 2 is to improve understanding of the pathogenesis, immunology, and clinical diagnosis of Lassa fever infections to inform the development of medical countermeasures. Number 3, to support research and surveillance with appropriate sampling methodologies to accurately characterize the current epidemiology and disease burden of Lassa fever in West Africa. And finally, last but not least, is to strengthen the clinical, laboratory, and research, public health, and regulatory infrastructure and workforce in endemic areas for Lassa fever, so that we can, 1, promote awareness and education about Lassa fever, 2, improve capacity for early and accurate diagnosis, 3, to promote optimal case management and clinical care, including the availability of critical care and enhanced supportive care in strategically located healthcare facilities within West Africa. 4, provide capacity for conducting clinical trials and other field studies applicable to the medical countermeasure development. And last, number 5, allow for assessment and licensure of new medical countermeasures for Lassa fever. Now, in terms of the diagnostics, and looking at here, we actually have 3 of those. 1 is to promote the development and assessment of affordable point-of-care immunologic and nucleic acid-based Lassa fever's rapid diagnostic tests that capture the wide genetic diversity of Lassa fever virus strains. 2, develop guidance on forward deployment and best practices for using rapid and confirmatory tests to diagnose Lassa fever. And 3rd, to create a network of laboratories to perform molecular characterization or sequencing of Lassa strains isolated from rodents and humans to assess genetic changes over time and by geographic region in endemic and at-risk areas. Next, we've identified strategic goals for therapeutics. There are 4 of these. 1 is to more fully evaluate ribavirin for treatment of Lassa fever and to determine the appropriate role of ribavirin in clinical trials of new therapeutics. 2, to develop, evaluate, and license new and improved affordable therapeutic agents for treatment of Lassa fever and prevention of Lassa fever-associated sequelae, as well as both pre-exposure and post-exposure use to prevent Lassa fever infection for the multiple Lassa lineages. 3, determine the best strategies for treatment with therapeutic agents and supportive care for Lassa fever patients and develop applicable guidelines. 4, to continue to stimulate research into areas that will enhance prognostic capabilities for Lassa fever, such as the use of clinical presentation criteria and/or measurable biomarkers, such as quantitative assays for measuring viral load. Finally, we have vaccines for which we've identified 2 strategic goal areas. One is to develop, evaluate, and license affordable Lassa virus vaccines that protect against the multiple Lassa virus lineages for preventive and reactive outbreak use in Lassa fever endemic and at-risk areas. And finally, to identify vaccination strategies that, 1, optimize the potential public health impact of these vaccines, consider the regional epidemiology of Lassa fever in at-risk regions, which in this case would also look at future spread of the virus potentially in the animal reservoir and where the vaccine might need to be in the future, and to take into account the vaccine attributes for the specific vaccines that become available. Now, in terms of timeline for our work, I mentioned already that we had an in-person roadmap consultation with our task force and other subject matter experts in January in London. The roadmap as a draft has now been available online for public comment at the WHO site. It will remain there through June 8th. We are having our webinar today. Once we get the feedback into the WHO back to our working group at Wellcome and CIDRAP, we will then again meet again with our task force members to consider that feedback and to create a final draft. This will be done through June into July and August. We will continue to revise the roadmap with input from WHO and the other key partners. By August and September, we intend to publish the roadmap and begin the dissemination process by hopefully early September. Now, in terms of the roadmap availability, you can see that it's on the website at WHO in this link. In addition to the roadmap, which is 18 pages long at this point, is also the target product profile and a comment form that you then can forward back to WHO by June 8th. Let me just mention that the roadmap, as I said, is 18 pages long, but we are yet to fill in the milestones, the critical path analysis, and schedule of resources, coordination, and implementation, as that will come out of this ongoing iterative process where we are at right now. So with that, I want to close and just again thank you for your participation. Remind you that we are open for questions here, and you can do that by going down to the chat box in the lower right-hand corner. So please use that. I see that we have some questions that have already come in. Let me take what we have already. First, let's see here. What is the scope of the roadmap? Is it only diagnostics, therapeutics, and vaccines, or other prevention and control measures included too? Great question. While the roadmap is really focused on these 3 medical countermeasures, some other key aspects of public health preparedness response are included because they're needed to address countermeasures, such as the need to accurately characterize the epidemiology or the disease burden of Lassa fever in West Africa. However, the other important aspects of disease prevention control have not been included in the roadmap because they don't pertain to research and development. So, I mean, a good example of that would be rodent control to prevent transmission. So we recognize that these other areas need to be addressed as part of a broader public health control strategy, but we don't want to lose the focus of the R&D aspect of therapeutics, diagnostics, and vaccines. Another question. Let's see. Does the roadmap prioritize research and development activities? Actually, it does. Although activities are not prioritized in the current draft, this will be done after the public comment period is completed and feedback's been incorporated, the point that I made in that second to last slide. We really are now bringing together all this information in a final way that will allow us, with the task force input and WHO oversight, to do that. Another question, a couple more here. Has the issue of funding, which this case it says, which is needed for building infrastructure and capacity as well as research and development, been addressed in the roadmap? And the answer is yes. While not specifically in terms of dollar or euro amounts, funding we realize is crucial to be able to realize the vision of making affordable and accessible medical countermeasures. So this issue has risen to the level of the #1 strategic goal in the cross-cutting issues section of the draft Lassa fever roadmap. Frankly, development of sustainable value propositions as well as international philanthropic, public-private partnerships, and innovative methods to secure funding have to be identified as clearly very key parts of what we need to do here. So hopefully these roadmaps will provide an outstanding place to focus the stimulation of funders to help address this issue. One more question here I see, maybe several more questions. One is, has the roadmap development work been used for the 2018 outbreak of Lassa fever in Nigeria? So thank you. Actually, again, the answer is yes. On May 10th, the WHO reported the Lassa fever outbreak in Nigeria was contained, but continued vigilance is required. It turns out that our draft Lassa fever roadmap was done sufficiently in a completed manner that it was one of the major resources that's been used as a guide in kind of the multifaceted response of the WHO, the Nigeria Center for Disease Control, and other partners during the outbreak and going forward. So already we've realized some of the benefit from this very process. So I don't know if I have any other questions. Let's see, one that just came in here. Let's see here. I'm just pulling up another one that just came in. Are there any plans for vaccine development of the reservoir host? And at this point, we do not have that as a priority in terms of how to vaccinate the host. Clearly, that's a challenge given that it's a rodent that's widely distributed through the area. Is there any plan to support data sharing? And at this point, I assume that you mean by data sharing in all the R&D. And yes, within the context of what is public data, surely that's the case. This is one of the major areas of enhancement. That which is private sector proprietary data, obviously, will be handled as we see in any other kind of R&D process. Another question, the roadmap doesn't appear to attempt to determine the magnitude of secondary transmission in convalescing Lassa patients shedding virus in urine and semen. This is a very helpful point and one that we will bring back to the task force for further consideration. And I think one here, will the roadmap have detailed draft protocols related to possible clinical studies? And as such, they will highlight the need for these, but we will not dive into detailed clinical study protocols, but we recognize the importance of those. And I can't see any provision for epidemiologic studies that seek to determine the possibility of vertical transmission of Lassa. And I would just say here again that this will be something we'll take up as part of the ongoing process to identify this. Obviously, the importance of vertical transmission is a very key one, and we will do that. So I think that takes the questions that I see here before me right now. Don't have any other questions. I would urge you to please go to the roadmap on the WHO site and provide your comments. These are very important to us. Now is your time to have your input, and we will be meeting again with the task force earlier this summer, and will at that time very much consider the comments that you provide. So with that, I want to thank all of you for your participation today. Know that this is a living process and a living document, and we look forward to your participation. And most of all, we want to remind the world that Lassa fever is a very important disease for which we really do have a incumbent upon us to do the work that we're doing right now with this. So with that, I will sign off. Have a good day, and thank you again very much.